Okay, see if going on. This guy has a cataract. Cataracts are cholesterol plaquing, and it's never a good sign to see cataracts for what it means in the brain, because of cholesterol being used as the body's main antacid. Your adrenal steroids are made of LDL, and your adrenal steroids are key in the body's using them initially as antacids. Medical doctors use cortisol as an antacid all the time. So does your body. The problem with taking that external to the adrenal glands is losing the adrenal gland production of cortisol, which most people can't afford. That same steroid controls sugar metabolism. So when you have low cortisol levels, I don't care what blood work shows or anything else, when you run low cortisol levels, you run low blood sugar or hyperglycemia, which is type 2. And correct the adrenal glands, and either one of the hypoglycemia, which is low blood sugar, or hyper, which is type 2. Both of those will go away nice as you please. But that's an adrenal gland issue. And so cortisol is real important. When the body doesn't have enough progesterone and cortisols and your corticosteroids, the body will turn to cholesterol as a direct substance to use as an antacid. And this is when you start to see the buildup of it up interstitially. And that's in the wall of the vascular system, in the eyes, in the brain. It's all over. So if cholesterol is an antacid, it's a lipid, meaning a fat, how would you get rid of that? Yes, if it's an antacid, then it's in the lymph system, and what system would you have to focus on? See how we keep coming back to that lymph system again? I tell you, you can almost keep coming back to it all the time. I would use upper circulation and move blood around in my head and in your eyes. I would also move that lymph system. You're on something N-acetyl carnosine or zine. I don't use those. Once in a while, I use acetyl L-carnitine to pull oxygen maybe up in the brain when I have some very advanced cases, but I've never seen any great improvements at all from it. So, you know, sometimes I'll flip and use something like that when I get desperate, but to tell you the truth, I just never see any benefits from that. It's really a lymphatic problem. And taking a form of an amino or anything like that, I tell you, if you're going to use an eye wash, make sure it's like ours, where you have lymph formulas and blood formulas, where you're increasing blood flow in the eye and you're increasing lymph drainage. A good eye wash will give you a lot of mucus in the eyes. It'll start cleaning that eye. And internally, you've got to drain your lymph system down through here, down through the axillary lymphs, and then right out those kidneys. So again, you're going back to a kidney and adrenal gland problem. You're going back to a lymph stagnation problem. You particularly see this and glaucoma, which is lymph pressure. This is the lymph system. And this is an acid pressure, not good. Then you can get MACD, which is macular degeneration, wrinkling of the... I mean, there's all kinds of names associated to the decay and breakdown of tissue when acids are stagnant in those tissues. It's just unlimited. They're not causative factors from other things. It's kind of like this Huntington they blame on genes and things like that. You know, best you don't go there because it's not important. Cells are damaged and mutated and with each generation. Unless someone's cleaning their lymph system and rebuilding their cells, you're going to alter the genetic makeup of cells. If you get too wacko with the gene theories, then it's like, oh, I carry this gene, like you're carrying a little baby around. Oh, give me a break. I mean, it's just ridiculous. It's just simpler than that.